Prepare STL presents What Matters to Me Most with Dr. L.J. Punch, trauma surgeon and founder of the TSTL. Learn more at preparestl.com.
This is Dr. L.J. Punch, trauma surgeon and founder of the T, a community health working to reduce the impact of trauma in the St. Louis region and the impact of COVID. This episode of What Matters to Me Most, I'm really excited to invite along with me Etoya White. He's going to be meeting with me to talk about the impact of COVID on the mental health and well-being of Black men and boys and how we can seek to move forward and persevere in this ongoing pressure of the pandemic. Now, Etoya, he no joke, former football player, St. Louis native, and he's got a really great beard. So let's sit down with Etoya and hear what matters to him most in this ongoing era of COVID.
What matters to me most.
Etoya White, welcome to What Matters to Me Most.
Thank you for having me, LJ.
It's good to see you. Listen, for folks who don't know you, although I don't know how people don't know, right? So let's just get people caught up. Tell us a little bit about yourself and the work you're doing in your life here in St. Louis.
Yeah, so born and raised here in St. Louis. I was grew up on the west side in the Wells Goodfellow neighborhood, and graduated from Parkway Central High School through the DSEG program, and grew up there. My mom, my brother, my sister, and then I have my other siblings as well. So there's about 8 of us total. Love them dearly. And left after I graduated from high school. I went away to Missouri State, played ball for a little bit, and then left, kind of took the circuitous route to graduation. Bounced around a little bit before I ultimately landed at UMSL, University of Missouri St. Louis. Finished my undergrad degree there, finished my master's there as well, and now I'm currently in a doctoral program in K-12 leadership and character ed and servant leadership. So professionally, I was in juvenile justice for a while. I was in education as a professional school counselor and also worked in school district leadership with the Riverview Garden School District, but I'm currently in solo entrepreneur mode as a clinical therapist and education and mental wellness consultant.
Wow, so West End.
Close, yeah.
West End, but sounds like your story has taken you through a lot of different parts
Absolutely.
of the educational environment in St. Louis. How long have you been in your own practice?
I finished, I became fully licensed last year, so I'm approaching a full year of private practice.
So you have basically launched a new practice in the middle of a pandemic.
Yes.
I'm sure
Yes.
that was easy. Not, right?
Right, it was, so I've always been close to the work,
Yeah.
right? Through education and through juvenile justice, I've always been close to the work, so this is my opportunity to really just kind of get out and just do my own thing, because there's so few, as a unicorn, which is what we refer to Black male clinical therapists. The time was right, even though it was chaotic with lots of different things going on. There's so few of us that it was just necessary for me to get out and add my name to the list of service providers.
So let's key in on that a little bit, because clearly, even though the pandemic that we have seen has been one about viruses and infections, the real impact of this pandemic has been in our well-being and specifically in our mental health.
No doubt about it.
What is the word on the street right now when it comes to those concerns? What are people thinking about and worried about the most?
I think more than anything is just really this dynamic approach to creating a new normal and what that's actually going to look like, or if such a thing will take place, like what is normal? What will it look like? Or are we getting into spaces that we should have been in the first place, or that we have been, denying or fooling ourselves, right? Because a lot of things that are happening with regard to trauma, these things have always happened.
Yeah.
These things have been happening for decades. It's just a matter that now we have exposure now, which is revealing how much access we actually have, and that's what's causing us to have to move to action now.
So what is in your practice in terms of things that are allowing you to get those mental health resources to young men, young kids, young people, and tell me a little bit about how COVID has changed what you're getting access to in your practice.
Yeah, so we're now understanding that we need to, there's several different entry points. So for people in and from Black and brown spaces, typically the entry point to mental health, the field of mental health, is through education. And that is at the elementary level or middle school level. I mean, our exposure to counselors and social workers or whatever have you is through some kind of academic behavior, some kind of intervention that's taking place in school that gets us in front of a counselor or a social worker or whatever have you. Now that we have a really wide open view of what's taking place, now we're seeing these different entry points with regard to, all kinds of issues, church hurt and, socioeconomic issues and all these different things where this access to mental health services is necessary for a variety of different reasons. Again, just like you stated, just our overall just health and well-being. It doesn't necessarily have to be to address a problem of some kind, but now we're just talking about maintenance, like going to the gym. Like, our nutrition and all these things, our approach to mental wellness needs to be on par with those things as we take care of ourselves holistically.
It's interesting because I've talked to a lot of people about how COVID has ended some things that needed to end and needed to change. And what I'm hearing from you is our lives and the way we live our lives, kids aren't just in school all day and then go home and vanish. Like, there's all these other things that have now come to the surface where we're recognizing there's a need.
No doubt about it.
So what are people coming to you most with right now? I mean, what do you see driving the health and well-being, the mental health, the mental well-being, as you say, of our community?
Anxiety is huge.
Yeah.
Anxiety issues because, people are trying to figure out what's like what they can touch, taste, hear, feel, and smell. When we talk about vaccinations, all these things, returning to school, the different plans, there'll still be kids who are working, remotely or whatever have you. And people are just trying to put two pieces, like everything's a 10,000 piece puzzle right now. And people are just trying to find two pieces that go together that make sense to try to, figure out what life is going to look like, because it's not going to be the same.
As a trauma surgeon, I have met people in the midst of highly anxious situations, and that anxiety from not knowing, having incomplete information, and nobody even maybe sometimes being able to tell you what to expect. It creates a need to make decisions without adequate information. And so much of what we've been talking about on this podcast is, how do people make decisions? They make decisions based on what matters to them most. So when you see people grappling with that anxiety, with the kids back to school, me back to work, day to day, what's going on with COVID, what matters to people most? What are you hearing?
That's such an important question, because so many people are operating in survival mode, came into this operating in survival mode, and now going through this, right? It is, what changes have been made, or what does life look like different, or am I returning to that mode of living, right? So we're dealing with a lot of the same core issues, but now we've got these other layers on top of it with regard to the health and safety of our children as they return to school.
Yeah.
Like people who have lost, jobs, or still dealing with employment issues, things of downsizing, if they worked in, the hotel and, restaurant industry or whatever have you. And so those, with regard to the pandemic in and of itself, those are the additional layers that have been created now that we have to be able to deal with and support people through, because kids are going to go back to school coming off of a summer that's just been outrageous so far, right? And so we have to return to some kind of stability, some level of stability in one of these areas. So again, we can just literally feel our faces and understand what's going on. So that's generating fear, and that, that drives the anxiety, which, outside of it being, okay, this is our body's natural response, these are the additional layers that elevate us to the point of needing somebody like me, a therapist, or, everybody doesn't need therapy, but everybody needs relationships. Are we operating in spaces with healthy relationships with other people that allow us to experience vicarious resilience, which is our ability to overcome struggles by seeing other people overcome struggles?
Vicarious resilience.
Yep.
It's interesting because The conversation around vaccination is a similar conversation. It's just our body's resilience in the setting of still being bathed, still being surrounded by COVID, and now facing this much more serious variant. Are you seeing the vaccination choice giving people freedom from some of those anxieties, or is it actually, for some, making it worse?
I mean, it's 6 of one, half a dozen of the other, right? So it just depends on the space that you're in with regard to the information that you either have access to or the information that you seek.
All right, say that. You got to say that louder. For the people at home, come on, give it to me one more time. Information what?
The information that you have access to or the information that you seek.
Yes.
And that's, that's it. That's huge right now, again, because so we go into this already knowing that historically people in and from Black and brown spaces have this, either or just traumatic history with health science. This is historical, right? So without seeking additional knowledge or information for ourselves, we may tend to lean on that as a reason to not seek additional information. Well, we already know this. This is how certain things have been done. This is how things have been done historically. And then we maintain that jaded view, which has merit to some degree, but we're talking about now, what we need to do with ourselves now, what we need to do for our bodies now, because our grandparents and great-grandparents, they could eat, greens and chitlins, they could do that, and they got 85, 90 years. Well, food is different now. Life is different now. The environment is different now, so we have to think and do things differently.
We'll be right back. Learn about the pros and the cons of the COVID-19 vaccines. Visit preparestl.com to get the facts. Remember, the choice is yours. Prepare STL, helping St. Louisans of color prepare and prevail. This is What Matters to Me Most with Dr. L.J. Punch, trauma surgeon and founder of the TSTL.
I love that. I hear you. And you're a clinician whose job it is to support people's mental well-being, and yet you're asking, I feel like what I hear is a call, get informed.
Flat out.
Get informed.
No doubt about it.
And you might have heard this, and you maybe saw someone say that, but it's your job to inform yourself. Where are you looking for your information about what's going on with our health?
Colleagues, just keep myself, informed, do my own research. I mean, I'm in a doctoral program right now, so research is a part of my life. So I do that, and I have 3 teenagers, and keeping them safe. And in addition, is being as informed as possible for my clients as well. There's an education piece that through therapy and through coaching as well. That's critically important. And oftentimes when people learn survival or panic mode, they're looking for something to grasp. They're looking for something to hold on to. And so it's our job, to be as informed as possible. And while we don't give advice necessarily, it's important that in supporting people who make decisions, we help them work through that process of determining what's best for them. And part of that is disarming some of those fears and the anxiety and helping them to understand what the main thing is for them, much like you say, but then help them to keep the main thing, and focus their decisions on what's best for them, as opposed to, well, Uncle Bobo and Cousin Ray, they're not getting vaccinated. We're not going to do that, or whatever have you. Well, okay, that's fine, but your body operates differently. The environment that you live in may operate differently. What you're exposed to may operate differently. And having lost somebody that I know to COVID who was 47 years old and in tip-top shape, wow, I'm not playing games. Because there's too much that you don't have control over. There's too much that you can't influence.
I have said that I think the future of COVID is in the hearts and minds and the choices of our young people, because those are the bodies where the virus can continue to live and spread and impact the lives of people around us who are maybe older or sick and more vulnerable. And I'm surprised and I'm encouraged that you believe people are strong enough to make those decisions for themselves, even in the midst of all this anxiety and unknowns. Wow.
Yeah, I think so. I mean, it's just oftentimes in the face of that information, it's still where influence lies. Because I could have all this information, right? And I know that this is the right thing to do, or the most reason, or the right thing for me to do. The right thing and the right thing for me might be mutually exclusive, right? So in understanding what the right thing is for me now, how do I approach influence? So am I prepared to push back against, family, whatever environment that I come from that says this? Because we have people that are, hey, I'm pro this and anti this or whatever have you. But are you courageous enough and understand enough about your own needs in any of these areas, mentally, physically, spiritually, emotionally, whatever the situation is, to decide that for yourself and then be ready to put healthy boundaries in place to push back against those influences that are contrary?
Are you courageous enough to meet your own needs?
That's it.
That's the challenge. That's it right there.
Yep.
And you're available and others are available to meet the need when people decide to take care of themselves.
No doubt about it. We're here for that. That's my call as a servant leader in this industry. And again, I've always done this work. And that's what I'll continue to do, is help people understand that they have everything that they need. You just got to decide your decision.
On top of all the trauma that you see in our community, COVID has hit the lives of Black men and boys really, really hard. Mm-hmm. How are those same Black men and Black boys going to get out and move forward in the face of COVID?
Relationships, right? None of us, human beings, we don't exist outside relationships. I got that from one of my favorite grad school professors. And understanding that, and as I stated earlier, everybody doesn't need therapy, but everybody needs relationships. And it's in the framework of those relationships. So what we've seen is we can create communities of men that allow us to learn from each other, to grow, because everybody's not going to find a therapist, right? That we know that's not going to happen. But again, the healing in a lot of these spaces can happen in the community of relationships. It's almost a biblical concept, right? So that we can heal and grow just like we seek wisdom, we seek knowledge and information. We can do the same thing by watching each other grow and heal through some of the struggles that we encounter, because so we deal with layers of things, right? So Black men and boys deal with faulty concepts of maleness, manhood, and masculinity that create these, the inability to morally and emotionally reason, right? So now we're not able to, as kids, we're not able to connect emotion with action, and vice versa. We're not able to connect action with emotion, right? Because of those faulty concepts. Then we vacillate in this struggle through adolescence between who raised us and who hurt us. And oftentimes those are the same entities, right? Who hurt us and who raised us is the same people, right? And so once we get through, because we have these faulty concepts and these maladaptive, behaviors, we're just on this spiral of confusion until we get to the point where either we've developed some, a pattern of unhealthy relationships, or we get to the point where we've encountered some health challenges related to stress, anxiety, depression, PTSD, or whatever have you, that have us, we've hit our head against the wall so much, therapy becomes that last option now. Instead of the first option, it's the last option, because we don't have any place else to go. What else is there? Now I'm going to try it. Or in this community of relationships, oh man, Uncle James did it, and he said, it worked for him. Well, I'm going to try it now. Or if we're in a relationship, if that's, some marriage counseling or whatever have you. And very much like I stated before, our entry point is through something negative, as opposed to understanding like we can maintain our health and our wellness just like we do going to the gym, or just like we do with plant-based eating or whatever it is that you choose to do. We can do it the same way and heal through these struggles. But the stigma still exists. And that's why I'm saying, okay, great. If we focus on communities of relationships, that can be the conduit to more men seeking help through mental health challenges, like myself and Terrell Borman and Tessie Amos and a lot of the other brothers in here in the industry, and we're in this field together trying to do this work. If we start there, right, that's a less intrusive, that's a less imposing way. If we just have these consistent communities of positive relationships, those can be the springboard. It can't be the other way around. It doesn't work the other way around. The entry point needs to be these healthy communities of relationships where we can change these faulty concepts and look at our men and boys and not project sports and all the other things on them that cause them to not understand themselves, because if they're not successful in sports, they're not successful. We have to stop projecting that on them.
It's interesting because COVID tore us apart. It made barriers in our ability to connect, and what I hear from you is the way we find a way forward is with each other.
No, without question. Because as a communal people, that's where we come from. That's how we survived. That's how we got to this point, was through community and through. So that's how we got here. And in order for us to defeat this, coming out on the other side. So now we've seen. So what has been exposed through COVID is the true weaknesses of our education system, of the economic framework of our cities. And this is St. Louis. We already know how it is in Hustle City, USA. We know the history of it. You just open a book, do a Google search or whatever have you, and you can get all the information you need about the history of St. Louis. So now what are we going to do, right? Can we understand, Tulsa, we understand all these different places where communities of Black success have happened. How can we do it here? What can it look like? Are we courageous enough to push back against the structures that have governed this place for so long, so that we can create what we know is going to be successful for Black men, and it can't look like what everybody else does? That's the courageous part. We have to be able to say in an advocacy, this is what's necessary for us to stop suspending Black boys at a disproportionate rate. Doesn't require anything other than making a decision to stop doing it, and then having the resources in place to actually meet those needs that have been presented. We already know what they are. We've been doing this forever. Make a decision to stop doing it, just like California and Connecticut and some of these other places that have said, hey, at the elementary level, we're not going to suspend kids 2nd grade and below or whatever have you. Okay, so what are we waiting for?
Such an important decision, as all those kids who went through this past year are going to be going back to school. It's a huge opportunity to do things differently, even a few months from now.
Without question. And all it takes is having the courage. That we know there's all kinds of DEI stuff happening, diversity, equity, inclusion. There's all kinds of stuff that's happening right now. Dr. Howard Fields, and I read through his book, there's so much out here, and none of it's new. The problem is decisions just need to be made. They need to be backed up with resources, and we need to train people in order to maintain these systems so that they can be sustainable.
I can't say anything more than that. That's perfect. Thank you so much for coming on What Matters to Me Most. I appreciate your perspective, and I appreciate the work that you're doing for our young men in our community.
I appreciate it. Thank you.
You are not just a unicorn, you are a precious gift.
Thank you.
We appreciate you very much.
Thank you, Doc. I appreciate you.
All right.
All right.
What matters to me most?
Courageous. Are we willing to ask the hard questions of ourselves and to recognize the obvious choices we need in moving forward? I'm so glad to spend this time with Etoya talking about the choices we have in front of us to be brave, choose better, and power ourselves forward, but not alone, in community. That is the key to our ability to move forward in the setting of COVID in the region. I really appreciate this time to reflect on what it means to be well, on mental well-being, and the ways in which specifically Black men and boys are going to power forward courageously in this next year.
What Matters to Me Most is a presentation of Prepare STL. Prepare STL is a collaboration powered by the Missouri Foundation for Health in partnership with the Regional Health Commission, the City of St. Louis County, and other community health organizations to help prepare all St. Louisans for the effects of the COVID-19 response, how to stop its spread, and how to survive the pandemic physically, emotionally, and economically. Don't miss an episode of the What Matters to Me Most podcast with Dr. L.J. Punch, trauma surgeon and founder of the TSTL, for the latest conversations on COVID-19 and STL, vaccines, racial health disparities, physical and emotional well-being, and more. Download the podcast at preparestl.com or wherever you get your podcasts. Executive producer, Vector Communications. What Matters to Me Most is another positive production of Rare Gem Productions.